Now, how will you diagnose a patient of fibroids? First of all, you will obviously look for the symptoms, all the symptoms, heavy menstrual bleeding, the pressure symptoms, back pain, frequent urination, everything. They will be indicating that the patient might have fibroids. Now, what are the investigations that you will do? First of all, before investigations, you will examine the abdomen. While you will be examining the abdomen, you will obviously see that the uterus size is enlarged because of the fibroids. And you will also do vaginal examination in order to see if there are some small fibroids which are present, or there are some fibroids which are going to increase in size, which are really small right now, or they are small in number. So through examination, you will know that if the uterus size is enlarged or not. Okay. Now, the investigations that you will do, the first investigation is the ultrasound. Ultrasound से आराम से पता चल जाता है if the patient has fibroids or no, not. The ultrasound will tell us that how many are there, the number of fibroids. It will tell us the location of fibroids, where they are located, and it will also tell us the size of the fibroid, so that we know how to treat it. Other than the ultrasound, MRI is also an option which will tell us about the location, size, and the place of the fibroid present. Now, is the fibroid treatable or not? Fibroid is 100% treatable. You can control it with the birth control pills or the intrauterine device. But obviously, it is a thing that is producing pressure effects, and it is a pathology. So we can remove it through surgical methods. Now, what are the surgeries that are involved in the removal of the fibroids? Uterine artery embolization, basically an artery that is supplying the uterine wall. If you embolize it, if you block the blood supply that this artery is supplying towards this wall, if you block the blood supply, obviously the fibroid will also shrink and it will shed. It will shrink. So this is known as uterine artery embolization. Other than that, ultrasound focused or radiofrequency ablation is also an option. You will ablate it, and the last option is always hysterectomy, that is the removal of the uterus, but obviously it will occur in the patients who are postmenopausal, who do not want to conceive, and it is always the last option. So there are some myths for related to the fibroid, that it is not treatable, that we have seen it is treatable. Obviously pregnancy, that we have cleared that yes, pregnancy can occur in fibroid, and should we treat it or not? If it is not, first of all, if it is asymptomatic, it is a benign tumor, it will not be malignant, so it's not compulsory to treat it. If it is asymptomatic, you don't need to treat it. But yes, if it is symptomatic, so it's better to treat it. Why? Because it you will have a poor quality of life if it is left untreated, and the poor quality will be obviously due to heavy menstrual bleeding and pain, back pain, and frequent urination, and all the other symptoms. So that's it about the fibroids. If you want to know anything else, kindly let me know. Thank you.